Hi, I'm Dr. Rick Duplantis with a few tips on managing your blood pressure. You know, hypertension is a diastolic pressure of greater than 90, a systolic pressure of greater than 140, or as we say it, 140 over 90. Anything above those numbers is considered hypertension. But the numbers between 120 systolic over 80 diastolic to 140 over 90 is considered prehypertension. If you find yourself in that range of prehypertension, or if you're just over the borderline of 140 over 90, there are lifestyle changes that you can do to avoid going on blood pressure medication. So if you've been recently diagnosed with hypertension, ask your doctor if it's right for you to go on a lifestyle change, a lifestyle modification program for 3 months to see if you can lower your blood pressure without the use of medications. You know, there's some great drugs for hypertension out there. You know, there are many, many different classes. You know, the diuretics, you know, the beta blockers, the angiotensin receptor blockers, and the ACE inhibitors. All of these drugs and many more control blood pressure beautifully, but many of them have side effects. And if you can control your hypertension without drugs, you'll be much healthier for it. And for a few tips, reduction in body weight, a loss of 5 or 10 pounds will lower your blood pressure. Increasing the amount of fruits and vegetables in your diet will greatly reduce your blood pressure as well. Exercise, moderate exercise 3 times a week will lower your blood pressure. How do they do that? Well, very simply. The diet rich in fruits and vegetables and the diet and the exercise program combined increases the production of a compound we call nitric oxide in the vascular walls. That part of the vascular wall we call technically the endothelium, to be anatomically correct. The endothelium produces nitric oxide. The role that nitric oxide plays is to relax and dilate the walls of the blood vessels in your body. And also as well in the brain, in the coronary blood vessels, those in your heart. So increasing your vegetables and fruit intake and also exercising will boost this production of nitric oxide. Reduction in weight will also help to lower this blood pressure by another mechanism. Reducing your salt intake, keeping it below 2 grams is very important. And you have to start reading packages to see how much sodium is contained in food. When you lower your sodium, you reduce your intravascular fluid volume. It's less fluid that the heart has to pump around the body, and it takes the work off the heart and also lowers the blood pressure. So keep in mind, reduction in salt content, watching your salt intake, keeping it below 2 grams per day, exercising, and following a diet rich in fruits and vegetables, more or less the DASH diet, is a diet for controlling hypertension. You know, follow these steps and you'll have naturally lower blood pressure and will avoid the use or having to get on blood pressure medications which could have side effects. I'm Dr. Rick Duplantis. Now back to my show. Hi, I'm Dr. Rick Duplantis and welcome to my show, It's Your Health. Tonight I'm going to talk a little bit about hypertension. You know, hypertension, or high blood pressure as it's called, is a risk factor for several serious conditions in our body. Number one, it's a risk factor for cardiovascular disease, heart disease. It causes atherosclerotic plaques. It causes damage to the blood vessel walls. As the blood pressure rises in the arterial walls, this blood pressure causes a stretching of the arterial walls themselves, the endothelium. This causes scarring and tearing. These tears start to attract the cholesterol that's in our blood to accumulate into these walls. Also, the blood platelets also start to clump together and also accumulate in that scarring wall, thus bringing about a more narrow blood vessel and thus making it harder for the heart to pump that blood against this resistance. You know, there are many different causes of hypertension. We have what's called essential hypertension and secondary hypertension. Essential hypertension, you know, it can be from consuming too much salt in your diet. When we consume a great deal of salt in our diet, it will and can increase our blood pressure and bring about hypertension. what salt does is, like my old professor used to tell me in medical school, where salt goes, water follows. And when we consume a great deal of salt and it's in our bloodstream, it pulls fluid within the vascular system. And the salt is reabsorbed in the kidneys, then bringing in reabsorbing water with it. We have an increase in pressure and fluid volume in these blood vessel walls, and the heart has to work that much harder to push all of this fluid around the body. One of the drugs used to treat hypertension or high blood pressure, the first line of drug that's used to treat in doctors will grab, is the diuretic, because the diuretic gets rid of this fluid and blocks sodium reabsorption in the distal kidneys to a certain extent. So salt is a contributor to hypertension. Another factor to cause hypertension is weight gain. You know, when we increase our body weight above and beyond our natural limits, it puts us at risk for high blood pressure. High blood pressure will put us at risk for heart disease, cardiovascular disease, strokes, and cerebrovascular disease, and also can cause what we call renal vascular disease. The blood vessels leading to the kidney can become occluded, can become narrowed, in other words. And this can lead to kidney failure. Lack of perfusion of the kidneys can bring about kidney failure. We call prerenal azotemia in the profession. You know, but blood pressure can be moderated and controlled in many different ways naturally. Of course, if your blood pressure is above 140/90, your doctor will likely put you on a blood pressure medicine called a diuretic. Okay, hydrochlorothiazide, the most popular diuretic used for these people who are recently diagnosed with borderline hypertension. Maybe it's 150/100. They'll put them on a diuretic. If the blood pressure is much higher, the blood pressure is 160/110, then that individual will be put on a blood pressure medicine such as a diuretic, hydrochlorothiazide, and they might be put on also an angiotensin receptor blocker we call ARB, or an ACE inhibitor. You know, these also block the mechanism of the renin-angiotensin system in the body, thus lowering blood pressure. That's how they operate. Another drug used if someone has a very high blood pressure, it would be a beta blocker to relax the walls of the vascular tree in the body. You know, many of these drugs, although they do control blood pressure, can have side effects. Let's face it. You know, drugs do have side effects. But when a physician prescribes medication, it is the benefit outweighs the risk for the medication, and the drugs are prescribed. But if you're an individual who you've just been diagnosed with hypertension and you really want to control it on your own, you can do that. You can attempt to do that. And a doctor will give you a 2 or 3 month trial based on the fact that your hypertension is not above 160 systolic over 112 or 120 diastolic. If it's like maybe 150/95, you know, your doctor will let you go through a diet reduction program, let you restrict your salt intake, and let you start exercising. You know, those 3 natural approaches to blood pressure can naturally lower your blood pressure. I think you owe it to yourself. Try the natural way first before getting on the medications. Like once people are on high blood pressure medications, they pretty much remain on them for life, except in the case of those who aggressively embrace a healthy, drastic lifestyle change. I'm talking about a great deal of weight loss. I'm talking about an exercise program that they follow 3 times a week, 4 times a week, and also a diet that they stick to, a very good, healthy diet, like the DASH diet, high in fruits and vegetables, you know, will help lower the blood pressure. You know, pomegranate juice will help lower blood pressure. Pomegranate juice is very good because it increases the production of a compound we call nitric oxide. Beetroot also increases nitric oxide production. Celery also can contribute to increasing nitric oxide production. Exercising 3 times a week will boost this nitric oxide protection in the blood vessel wall. Why is this so important? And why is this the contributing factor of lowering our blood pressure? Quite simple. Nitric oxide is produced in the endothelium, the inner wall of our blood vessels. When this is produced in adequate amounts, it causes the blood vessels walls to relax. These muscles in the blood vessel wall relax. They undergo what we call vasodilation and allows the blood pressure to be lowered naturally, but not too low or not lower than they normally should be, but with adequate blood pressure to perfuse all the vital organs. This is very important. You know, as we age, and one part of why some people develop high blood pressure is that we lose the ability to produce this nitric oxide in the blood vessel walls, which will normally and naturally relax the blood vessels when the blood vessel pressure increases beyond a certain amount, unhealthy level, let's say. This nitric oxide would kick in normally. We have what we call baroreceptors, you know, in the vascular walls and the carotids that are respond to pressure, you know, from the blood pressure and help to regulate the heart rate and regulate the blood pressure that way. The body is a wonderful miracle, we have to admit. And, you know, when we embark on this healthy lifestyle, in lieu of the drugs, when we have a borderline hypertension, then we take the responsibility, we take the power, we take that ability to lower our blood pressure into our own hands. And we become that partner in health with our doctor. Now, you know, you can try this for 2 or 3 months. If you lower your body weight by 10, 12 pounds, you increase the consumption of fresh fruits and vegetables. I would recommend adding pomegranate juice, 2 ounces each morning, first thing in the morning, of course. And I would say exercising. All of these things, the weight loss, the boosting of the consumption of these natural fruits and vegetables, the consumption of something like pomegranate. You know, you might even want to try meditation because stress is related to hypertension. These are the essential hypertension factors. And it's very important that we be cognizant of the fact that, you know, if we adhere to this healthy lifestyle change of diet and exercise, and incorporating these things into our diet, then we can lower our blood pressure. Try it for 2 months. Work with your doctor on this. Monitor your blood pressure during this time. You know, you can monitor it once, twice, 3 times a week while you're lowering your blood pressure. You know, getting back with your doctor on a regular basis as well, to getting him to monitor your blood pressure. You might be surprised that you can control your health by lowering your blood pressure, and that's a good thing. That's what's right. And, you know, in those individuals who go on this program and can't lower their blood pressure, then they can always go back to their doctor. The doctor will put them on diuretics, ACE inhibitors, ARBs, the beta blockers, those specific drugs that they need to improve their health. But you do have that option. You do have that option to increase your health, lower your blood pressure, lower your risk for heart attack, stroke, and renal vascular disease by controlling your blood pressure. I'm Dr. Rick Duplantis. I hope this segment on hypertension and how to control it naturally will assist you in giving you the control of controlling your health. Take care. God bless. Dr. Rick Duplantis.